In Medicine and Money, RXsaver Medical Expert Dr. Holly Phillips is here with health tips as the country reopens. Doctor, what are the best preventative steps to take?
I think we all have been looking forward to this long awaited opening, but I think we do have to keep in mind that although we're opening, it doesn't mean it's business as usual. Just because you can go out and do a lot of things you couldn't do a month ago doesn't necessarily mean you should. I think we have to keep in mind how this virus spreads and remember that it is still spreading strongly. The virus is at its most infectious when people are in close proximity to each other. I think by now we've all heard about the 6-foot rule, but also when people are in close proximity to each other for 15 minutes or more. You're much less likely to get the virus just passing somebody on the street as you are if you are sitting with someone in close proximity and talking to them. So we should even keep up our guard with close friends and family who we might tend to be closer with and let down our guard just to make sure we're not letting that vigilance wane. Some basic things: if you're going to a newly opened restaurant, you should sit outdoors. And if you see that restaurant's not following social distancing protocol, meaning the waiters or waitresses aren't wearing masks or the tables aren't set far apart, you could go ahead and choose a different restaurant. And then I think lastly, we just have to get used to the new normal. We may be asked for temperature checks walking into certain businesses or workplaces. And just like we grab our keys as we leave the house, I think we've got to get used to grabbing both our face masks, hand sanitizer, and washing our hands all the time.
What about people who are returning to the workplace?
Sure. I mean, offices can easily turn into hotbeds of contagion. We really actually know this. We see it in flu season, right? If you've ever worked in a busy office and one person gets the flu, you can see how it spreads like wildfire. That's in part because people are in close proximity with each other, but also the surfaces. You might share computers, you're sitting and touching the same tables. There's a lot of contact that happens in offices. I think many offices are going to start adopting social distancing rules as they reopen. But then as individuals, we still have to stay vigilant. That means wearing a mask or gloves, and again, washing our hands as much as we can.
Many people are unemployed and in need of health insurance. What can you tell us?
Well, it depends on what state you're in. Now, as a federal basis, the choice was not made to reopen the marketplaces. However, on a state-by-state basis, some states have opted to do that. So you can log on to your Affordable Care Act website in your state to see if that's an option. There are also some other low-cost insurance options, part under the CARES Act and just other resources that exist, both resources for primary care, vision care, dental care, mental health, and those can be found on our website, RXsaver.com, where you can also find information on how to save on your prescriptions by using the RXsaver app or the RXsaver website. You can find the lowest prices at pharmacies near you to make sure you're getting the best prices, especially if you have to pay for your medicines out of pocket.
Well, thank you so much, Dr. Holly.
Thank you. Stay safe.
For more Business First AM, check us out on social media. We're on Facebook, YouTube, and Twitter. And go to businessfirstam.com for where to see our show on TV.